Now, back in Cuba, CCTV's Michelle Begue tracked down the specialist who worked on this study. She's got perspective from the Cuban side.
How prevalent is the HIV virus in Cuba?
The
infection of HIV in reality is of low prevalence if compared to other countries of Latin America and the Caribbean. 22,000 patients have been infected with HIV since the epidemic began in 1986. Therefore, it has a low prevalence.
And how did this study come about?
In the year 2007, the study began because of the results being seen here that some patients were progressing to AIDS soon after the infection. This could be because of late diagnosis, because the patient didn't want to be tested earlier, but in other cases, the patient said their date of infection was relatively recent. So because of this medical observation, we decided to design a study that became part of the project that was in collaboration with 2 universities in Belgium.
What should Cubans and the international community take away from the results of the study?
It is important to note that we found no difference in how the virus responds to treatment, so all the variants of HIV respond in the same way. If you start treatment early, then there should be no problem. And Cuba is exercising the strategy to begin treatment when the patient presents 500 cells or less. But most importantly, first prevention, and then getting tested early.